Hi, welcome to the episode 2 of Cat Talk by Alice Cat Expert. Today we're going to talk about the litter box. Litter box problem is the most common reasons people contact me for behavior consultation. Not only is a very stressful problem for the cats, is affecting the quality of life, but also is a very stressful thing for the people because it also affects the quality of life. They are constantly cleaning, the house is smelly. Some of the people actually stop having guests over because they are worried how the guests are going to feel about their house. But before I start talking about today's topic, I want to again repeat a little bit of what I said in episode 1 is that when a cat stops using the litter box or any behavioral problem at all, it's not about being naughty, being lazy, being trying to pay revenge or any of these adjectives. Behavior isn't random. Okay, litter box issue means that something is wrong, and it's our job to figure out what is wrong. Now, obviously, the patient don't talk, so we need to do a little bit of detective work to figure out what went wrong. Litter box problem is not an illness in itself, is a symptom of something else. Okay, before we assume it's behavioral, because this is very common, people immediately jump to the conclusion to think that it's behavioral. We need to first check that it's not physical, because sometimes it's physical. And any change of behavior, not just litter box, but any change of behavior, we need to first check that if it is a physical problem first. Now, this episode, I'm not talking about quick fix. In fact, I'm not going to list list of solutions that to ask you to try, because it's super dangerous to ask you to do that. You could have delayed diagnosis if your cat actually have a physical problem. And to be honest with you, the loads of advice on the internet, I'm sure you try some of these things already, is working, not working, So I'm not going to repeat loads of things that is on the internet because this podcast is not about quick fix. It's not about those things because there are other people doing those things already. The reason I have this podcast is we are going to do a deeper dive of each of the issue. Now, we're going to talk about why random fix doesn't work, okay? Because first, I want you to know that not all litter box problems are the same. They're actually subcategory of litter box problem. The two main category is litter tray avoidance, and then you have marking behavior. And often the cases that end up in my consultation are both. Okay. And also very often it might combine with some other things as well, like the litter box problem and it is aggression and so on. In order to figure out what kind of litter box problem are we talking about, usually I will ask the clients a bunch of diagnostic questions. Now, these are just some examples I'm listing out here. I'm not trying to get you to go ahead to diagnose yourselves because, as I said, you could have a delayed diagnosis if your cat actually have a physical problem. But just to list out why I said that different kind of litter box problem, such as we need to know if we are talking about urinating or defecating or both. Okay. Are we talking about, if it is a urination, are we talking about a large volume of liquid coming out or small amount of liquid coming out? That means different behavior there. Are we talking about horizontal surface? Are we talking about the urine go on a vertical surface? Again, that would point you to different direction. Is it always the same location? Or maybe is it always the same 3 location or same 5 location? Or is it random, as in it's a generalized problem that it goes to many places, you haven't noticed a pattern at all? Is it near the boundary of the house, such as the front door, back door, the window sill? That would be one of the common phenomenon. Is it also soft furnishing, or is the cat obsessed with certain texture? So it needs to be a fluffy blanket, or something like that. Does it happen only certain part of the day? Is it morning or evening? Or is it during the day when you're not home? So all this information matters when I'm working with cases. Now, broadly speaking, if we're talking about a large volume of liquid on horizontal surface, on soft finishing, um, on corners, but horizontally, the liquid lying in the corner, that's usually a literature avoidance problems. And if it is a vertical surface, we're talking about the boundary of the house, as I said, the front door, back door, the window sill, and a small amount that probably is marking. But as I said, this podcast is not to encourage you to diagnose your cat yourselves. This is just some example to tell you that we're talking about many different kinds of literary problems. Sometimes it's a combination of several things. Now, let's jump back into the physical problem. Like, what kind of physical problem can a cat have to stop using the litter box? Because I get this pushback a lot from people saying that I know it's not physical. He doesn't look like he's uncomfortable. We don't know because the cat doesn't talk, okay? So it could be a case of urinary problem. So they feel pain and discomfort when they're using the litter box. It could also be gastrointestinal discomfort. This is usually show up as pooping outside the box. It's usually gastrointestinal. And then it could be urinary tract infection. It could also be this one is very underrated. Like people don't talk about this enough. Is mobility issue. Okay, so you go ahead to go to the vet and do all these tests to urine sample, fecal sample, and you find nothing. But no one actually checked the mobility issues of the cat. Okay, for that, it is very, very difficult for vet to check in a clinical setting because they can't see how your cat run around or climb or jump and things like that. You are the one who sees it. So I always recommend people to make videos and take pictures of the evidence when they go to the vet, especially when we're dealing with cats. Okay, so arthritis, mobility issue could also show up as a litter box problem. Simply, they find it difficult to go into the box and get out of the box. So they go very often. The symptom looks like they go next to the box. As I said, poop problem tend to be medical, so usually I recommend people to do what I call a poop journal. So basically, you take pictures of the poop every day, particularly the poop that is outside the box, and you keep a journal for a week or two. Then you have data to show to your veterinarian to check if there's something off with the poop. Medical problem in general, it means that the cat think that the litter box make them hurt and then they just stop using it. So it's litter box avoidance. Once you know it's not a medical cause for this problem, then we need to start to look into the mental health side of things. So is it stress and anxiety? Is it conflict with other cats? Is it sometimes there's litter box bullying, such as one of the cat blocking the other cat to have access to the litter box. It's sometimes very often simple things as that. It's just that you're not constantly looking at them. You're going to work and you go to sleep. You don't notice the bullying. They don't. It's like kids, they might not do it in front of you, okay? Sometimes it might be a case of lack of privacy. The litter box is in a very explode heavy traffic area, such as the hallway. Also maybe there's household changes. People getting married, new baby, moving, etc. can could potentially cause stress. In those cases, it will show up as marking behavior. But as I said, we need to make sure that are we talking about litter box avoidance? Are we talking about marking behavior? Even from a mental health angle, it could be either or both. If we don't think it's stress and anxiety, another thing I would dive into with client is to review the litter box setup. Litter box setup problem is way more common than people imagine it to be. Um, the problem is I found during consultation, I get a lot of pushback from clients. They will say things such as, well, they have always used the box. It's only new. It's only in the past 6 months. Or I clean it all the time. It couldn't have been the box. Or, well, they use it most of the time. The accident only happened every few days. So I don't think it's a box. They know the box. They use the box 90% of the time. I just don't know why these 10% of the time we have a problem. Okay. So usually my pushback to that is that, well, listen, We also use the public bathroom, particularly in a festival setting. Those horrible, horrible temporary bathroom, we use them. Well, correction. Actually, I know gentlemen, sometimes you don't use them. Okay. You go into the bush during the festival. Okay. And tell me why. It's a perfectly fine bathroom because it's not perfectly fine. Okay. So, how do you know that your cat don't secretly dislike the setup and they have been putting up with this? And sometimes on a bad mental health day, maybe every 3 days, they get to the point that they can't handle this anymore. And then there's one accident because they're just not in a good headspace. Okay. Now, I actually don't know why there's such pushback because if it is a literature sector problem, it's actually the easiest things and cheapest thing to resolve. Okay, if it is medical, you might have a end up to be have a vet bill. If it is anxiety, we have to go through a bunch of training. It's actually more complicated and more expensive. But I don't know, for some reason people have this pushback when it comes to literature avoidance. When I said that maybe it's the setup, maybe people take it personally. I don't know. I have no idea. But actually is the cheapest things if it is literature avoidance. It's going to be a very cheap problem for you to solve and you're lucky. Now let's talk about some myth buster. Because as we were talking about pushback, so there's some, I have a list here, some of the common pushback I get in consultation. Okay. Um, oh, but I clean it all the time. Maybe I just need to clean more. I found from my experience, you see, in this job for 16 years, the cleanliness factor is a little bit overblown, maybe by the internet. Of course, you should keep the litter tray clean, but within reasons. You shouldn't have to watch the litter tray like a hawk, and every time a cat used it, you need to jump in action. You need to drop everything. You need to, you know, ask for a pause on your Zoom call and things like that. That's not the way to live. Of course, it needs to be keep clean within reason, but it shouldn't have to you shouldn't have to do this, okay? Myth number two, it must be anxiety. But as I said, from my experience, I'm actually seeing literature avoidance, if not more, then at least is half the time when it comes to litter box issue. So I want people to realize and have the awareness that it might be the literature setup, because the internet is full of people talking about stress and anxiety when it comes to literature. I think it's overblown a little bit. The problem is then people go on internet and try different tips. See, if your problem is not even stress and anxiety, a lot of these tips you see on the internet is not actually helping your case because your case is not that. Okay? As a result, you end up wasting a lot of time and money trying to buy different things, moving furnitures and whatever. But you're not even in stress and anxiety case. See? Myth number three. My cat is being territorial. Before assuming it's territorial behavior, we need to check again, is it actually marking behavior? That's why we need to know the pattern of this behavior. Where is it? How does the pee look like? Is there a pattern? Is it only at night? Is it during the morning when you first come down from your bedroom? You see it right there. What are we even talking about? We need to know if it is even marking before we decide if it is territorial. But again, if you go on internet, people will immediately go in, it's territorial. We don't know until we have more data. As I keep talking about literature avoidance and how important it is to have a proper literature setup, you may wonder, so what am I supposed to do then? Uh, to have an ideal litter box, this is the list of criteria that is right in front of me. Okay. I think one of the things that is not being talked about enough is size. Most of the litter tray, when I say most, I think 90% of the cases I see, the litter box is too small. Okay. A lot of people don't know that the litter box is supposed to be one and a half the length of the cat. If you have a long cat, Your litter tray need to be bigger. Why do we need to have a litter box that's 1.5 the length of the cat? Is because when cat go into the litter box, they actually do a lot of things. It's not just to do the business. They need to go in, smell, dig, turn around, and then smell some more and dig some more. They need to have enough space for them to turn around. Not only that, they also need to have enough space to squat comfortably. Again, if you have a very small litter box, just like the example I used earlier, then will feels like those temporary bathrooms that we use in festival and camping. You feel very uncomfortable. You try not to touch anything. Those of you who have long hair try to put your hair into a bun. Especially if you have long hair cat and you have a small litter box and the litter box has a lid, then it's literally like the portaloo in a festival. Then it wouldn't be surprising that your cat doesn't like it. Okay, so size matters a lot more than people imagine. As I touched on just now, the lid and no lid debate, I think it depends on the cat from my experience. Some cats actually prefer to have a lid for privacy, especially in a multi-cat household. They don't want other cats to suddenly jump out from the corner and see them going to do their business. Some cats absolutely don't like the lip, particularly long hair cat. I noticed a pattern. Now, I'm making a statement like that. It's not peer review or anything. It's just from my observations of doing many, many cases. I noticed that long hair cat particularly don't like the lid. I suspect it's the fact that the hair is touching the wall of the litter tray and they don't enjoy it. And also another thing is most cats don't like doors. This is again my observation. So if this is something you want to try, if you want to go on internet, that's how you find out about my podcast, right? If you want to try different things, I'd rather you try these things. These are very cheap and very quick way to try. Remove the lid, remove the door. It's something that you can try literally today. Litter texture matters. Uh, Ideally, we want the texture to be soft, fine, sand-like texture. No scent, it would have been great. Clumping would also be great because not only the texture will matters to the cat, sometimes the humidity, the fact that the moisture stays on top, also could be one thing that annoys them. Now, I get some pushback on this one because people will be like, but my cat has been using the same litter since forever. Again, you know, something that you don't particularly enjoy with time, you get more and more annoyed. This is also a possibility. And also aging. Maybe their paw get more sensitive now. They already have joint pain, and then there's another thing to deal with to have to step on litter that they don't particularly enjoy stepping on. So again, this is a very cheap experiment. Just test different litter to see if one of them is more of the preference. I actually don't understand why there's such pushback because all these things is actually very simple and easy and cheap to test. Another thing I want to talk about is the location. Make sure that the litter box is not in a heavy traffic area. And then if you are multi-cat household, you need to make sure that one cat is not monopolizing the litter box and not allow other people to use. Um, and also, you might not want it to be next to noisy appliances, such as, in the utility room, you have the washer and dryer. If your cat is scared of those noise, that means that when you're using those machines, then they're not going until you're finished. And then sometimes they just simply can't hold it in, especially if they are aging, and then they find alternative location. Another thing I want to address when it comes to multi-cat household is that the textbook advice that the number of litter trays needs to be the number of cat plus one. Yes, ideally, if you can do it, but I work with an international audience. I mean, I have clients from places like big cities where they don't have a lot of space, I had clients from Singapore, I had clients from Tokyo, I have clients from London, I have clients from New York City. I can hardly make my client to put more literature when they live in very tight space, okay? So I think in cases like this, make sure to use your common sense. If you notice there might be resource guarding behavior, one of the cat is blocking other cat to use the litter box, you might need to figure out the strategy to prevent that from happening. Maybe there's one box in this side of the apartment, and then the other box is the other side of the apartment, to make sure that is more difficult for that one cat to be guarding both boxes because they can't be in both places, right? So use your common sense to figure out a way to make the situations better, even if you don't have a lot of space. I'm not a litter tray police, so I'm not going to say that you have to have this number of litter tray because, like, look, I am from a big city myself. I have always lived in big cities. Sometimes it's difficult, and I acknowledge that. Now, you may wonder if you have a litter box problem, what are you supposed to do now then? First, you need to take it seriously. Don't imagine it will go away. If it happens several times already, the chances is not going away naturally. You will need to do further investigation. Don't punish the cat. As I said, it has nothing to do with being naughty, revenge, and all this stuff. Don't try to pick up the cat and push the cat back into the box. There's a reason they don't want to go. They didn't forget about the litter box. Okay, they know where it is. They know it's a litter box. There's something about the litter box they don't want to go in. Don't use deterrent. A lot of people try to cover the crime scene, so to speak. Oh, it's that corner. Let's put some tin foil down that corner. The chance is the cat will just move to the other corner of the room. And then eventually the sometimes I see cases that the whole place is covered with tin foil. And obviously that affects the quality of life of the person because the tin foil is everywhere. And also the cat is also probably also very nervous because they don't understand why suddenly the tin foil is everywhere. What is happening? I'm already stressed because of a litter box issue, and now the tin foil is everywhere. So honestly, don't waste your time and energy and maybe money to do all this quick fix you find on the internet. Litter box problem often is very complex. It's a multifaceted problem usually. So I would recommend people to contact a behaviorist to look at an investigation as soon as possible. Sometimes I get pushback from people saying that, well, behaviors cost a lot of money, but most of the clients who end up with me, they would agree with me that they have spent way more money before they contact me. They buy different litter box. They buy, I even have a client who had to change the wooden floor because it was completely ruined. It cost her 3,000 euros. You see, that's 10 times more than my consultation fee, okay? And then have to get the builder in and, listen, it's much cheaper to go to an expert and try to solve the problem as soon as you can. It's going to be less stressful for your cat and it's going to be less stressful for yourselves. But don't forget, before you contact a behaviorist, make sure to talk to your veterinarian first to make sure that it's not a medical problem. And then once you get a clean bill of health, then please contact a behaviorist. So for today's episode, I want you to remember the take-home message is that when a cat stops using the litter box, they're not being difficult. There's something wrong. And as always, behavior isn't random. There's always a reason.